Disclaimer. This video content is AI generated as educational purposes only and is not a substitute for professional medical advice, diagnosis or treatment. Your health concerns may be unique. Always consult your physician or a qualified healthcare provider for personalized guidance.
You know that feeling when your head is just stuck in a fog and you can't breathe? Well, there's a huge battle going on in the world of medicine right now that could change everything for people who feel that way. We're talking about the fight against nasal polyps, and it's a real showdown. The surgeon's scalpel versus the scientist's syringe. So let's break down this high-stakes medical fight. It really all starts with these simple but incredibly frustrating things. You can't get a full breath through your nose. And the world? Well, it just loses its smells. No more morning coffee, no fresh-cut grass. And look, this is way more than just a stuffy nose. For millions of people, this is a daily reality, and it seriously messes with their quality of life. So what's actually going on here? The culprit is a condition with a mouthful of a name: chronic rhinosinusitis with nasal polyps. Let's just call it CRSWNP. The best way to think about it is like a relentless inflammatory storm that's always raging inside your sinuses, and that storm causes these little teardrop-shaped growths. And this isn't some rare thing. It affects up to 4% of people on the entire planet. That is a huge number. Okay, so for decades, pretty much the only answer was to go in with surgery and just cut the polyps out. That was the game plan. But now, a totally revolutionary new class of medicines is stepping into the ring, and it offers a completely different way to tackle the problem, from the inside out. So, which one comes out on top? All right, in this corner, we have the reigning champion, the tried-and-true surgical approach. This is the veteran of the fight, and it's known as functional endoscopic sinus surgery, or FESS for short. So what is FESS? You can think of it like a super precise, minimally invasive strike. Surgeons use these tiny cameras and instruments to go right into your nasal passages, no cuts on the outside or anything, and they physically remove the polyps and open everything up. The goal is simple: get your sinuses working like they're supposed to. The game plan here is pretty straightforward, but it's really effective. Step 1, get rid of the stuff that's blocking you up. Step 2, widen the natural drainage pathways in your sinuses to help prevent future issues. And step 3, and this is key, clearing everything out means that other medicines, like nasal sprays, can actually get to the tissue where they need to do their work. And here's where it really scores points: speed. I mean, the research is super clear on this. If you want the fastest possible relief from that awful blocked-up feeling, surgery delivers. It just physically removes the problem, and you get that immediate sense of being able to breathe again. But, and this is a big but, every champion has a weak spot, right? For surgery, it's this. It removes the polyps, but it doesn't stop the underlying inflammation that made them grow in the first place. And because it doesn't get to the root of the problem, a whole lot of patients, we're talking 15 to 22%, see those polyps just grow right back. And that weak spot, it opens the door for our next contender, the modern challenger. This approach isn't about cutting at all. It's all about chemistry. We're talking about a new class of drugs called biologics, and they go right after the root cause of the problem, the inflammation itself. Okay, so biologics, what are they? You can think of them as these incredibly smart drugs. They're basically engineered antibodies designed to hunt down and block the specific inflammatory signals in your body that are screaming, "Make more polyps." It's like sending in a special ops team to disable the enemy's entire communication network before they can even launch an attack. And this isn't just one drug, it's a whole team, and it's getting bigger all the time. We have major players like dupilumab and omalizumab, and the roster just keeps growing. In fact, another really powerful one, tezepelumab, was just recently approved by the FDA, giving doctors and patients even more weapons in this fight. Now, biologics bring a couple of massive advantages to the table. First, they are often way better at bringing back your sense of smell. And why is that? It's because they calm down the inflammation that's happening right in the olfactory nerves. And second, they can dramatically cut down on the need for oral steroids, which saves patients from all the nasty side effects that come with them. That's huge. Okay, so we've met the fighters. Now it's time for the main event. Let's put them side by side in a head-to-head showdown and see how they stack up on the things that really matter to patients. Round 1, speed. And yeah, this one's a clear win for FESS. Surgery gives you that immediate, I can breathe again relief. Biologics are amazing, but they work by shrinking the polyps over time, so that relief just isn't going to be instant. But then we get to round 2, getting your sense of smell back. And this is where biologics just really shine. Surgery helps, for sure, by clearing the path, but biologics go deeper, calming the inflammation right where your smell receptors are. The evidence shows they are just superior when it comes to restoring this incredibly important sense. All right, round 3, the long game. We're talking about recurrence. Do the polyps come back? And here, biologics just completely change the equation. Because they control the underlying disease, the polyps are way less likely to return. And that means patients are way less likely to need more surgery down the road. That's a huge win for biologics. And of course, we've got to talk about round 4, the money. Up front, surgery is definitely the more cost-effective option. There's no getting around it. Biologics are expensive. But get this, some studies are now suggesting that after about 3 years, by preventing the need for more surgeries and other medical care, biologics can actually end up being the cheaper option in the long run for people with severe disease. Now, you might be thinking, how do we know all this? Well, it's not just a hunch. To get these answers, researchers did some serious work. I mean, they waded through over 1,500 different scientific studies and carefully filtered them down to the absolute best 25 to get this critical evidence. This is top-tier, evidence-based medicine. So, after all that, what's the verdict? Who wins? Scalpel or syringe? Well, it turns out the latest science is telling us we might be asking the wrong question entirely. First off, let's be clear, not all biologics are the same. This chart here comes from something called a network meta-analysis. It's this really clever way scientists can compare a bunch of different treatments at once, even if they weren't in the same original study. It gives us a kind of power ranking, and when it comes to shrinking polyps, you can see dupilumab is the clear frontrunner, with the newcomer tezepelumab looking very promising too. So what does this all mean? It means there's no single silver bullet here. FESS is fast. Biologics are durable and get to the root cause. This has led doctors and researchers to ask a really groundbreaking question. Instead of making them fight, what happens if they team up? And the answer? Honestly, it's a game changer. Just look at this number. 0. In one study, they took patients who had surgery and then followed it up with biologic therapy. Their average polyp score, which is how you measure how bad the disease is, dropped from almost 5 all the way down to 0. That's not just a win, that's a total knockout. And that right there, that's the future. We're seeing the arsenal of treatments get bigger and better, with new drugs like tezepelumab getting approved. We're seeing this new focus on these powerful combination strategies. It's all moving away from a one-size-fits-all approach and toward care that's truly personalized for each and every patient. So it really seems like this whole scalpel versus syringe debate, it's kind of missing the point. Maybe the real victory isn't about choosing one weapon over the other. Maybe it's about building a smarter, personalized strategy that uses the best of both worlds to finally win the fight for good.
Hi there, forest friend. Thanks for clicking on our video. We're so happy you're here. Before we jump in, don't forget to like, subscribe, and share this video with your friends.